Hi, everyone. Welcome. Hi, Savannah. How are you?
Very good. How are you?
Good. Good. Nice to see you.
Great to see you again as well. We made
Um, we made it. It's like it's Wednesday,
it
you know.
Wednesday. We're in clinic. Here we are.
Good. Well, everyone, thank you for joining. And we have a really important topic that we wanted to talk about. My name is Dr. Vinita Tandon. I am a board certified endocrinologist and the medical director at Lifeforce. And super excited to have Savannah Harris today as our VIP guest. She is an acute care nurse practitioner, but specializes in cardiology. She's been doing inpatient hospital care as well as outpatient cardiology care. Savannah is very unique in that she really approaches cardiovascular health holistically. She integrates traditional medicine along with more preventative strategies and a wellness holistic approach. So it very much aligns with our philosophy here at Lifeforce to look at people as a whole being. And we know that it's Heart Month, American Heart Month, and we're just at the end of it. But I think in the US, we should think of every month as
Yeah.
Heart Month, since it's still the leading cause of death for American men and women. But thank you, Savannah, for joining. And you have to tell me where you're joining from.
Yeah. So I'm joining from Ventura, California.
Cool. We have a big California contingency
Yeah.
online today, so that's awesome. And I'm in the Bay Area, so not too far.
Love it. Love it.
So I think that many of us know kind of the more typical risk factors for heart disease: smoking, high cholesterol, family history, but there are definitely some more sneaky, underrated things that not everybody knows about or appreciates. So would love to talk more about that during this chat.
Definitely.
I do kind of want to zoom out a bit and just acknowledge the fact that despite so many advancements in healthcare over the past 100 years, heart disease still is the leading cause of morbidity and mortality for Americans. And it's a hard thing to reconcile because we are such a developed country and we have so many great tools at our disposal and great treatments, but yet we haven't hacked this.
Yeah.
Um, so we just kind of love your thoughts on, why do you think that is, and what can we be doing better?
Definitely. It's a great question. Great way to start the discussion. We know that one person dies every 33 seconds in the United States from cardiovascular disease. So even though we've made huge advancements in the medical community, the underlying issues, frankly, are still not being addressed. What I'm referring to is obesity, unhealthy diet, physical inactivity. These are a few of the core fundamentals to healthy living and essentially a healthy heart. And I feel like this is just an area that we're still not doing well at.
Yeah, exactly. And I know we're going to have time to kind of talk about maybe some of the reasons a little bit deeper into why that is, where traditional healthcare is failing us in a way. And we are not getting to root cause, and we're not doing a good job at preventing heart disease and atherosclerosis. But definitely would love to kind of know, how do you, when you approach somebody, I think there's a lot of kind of just lack of knowledge in terms of how much of their risk is genetically predetermined versus how much do they have ownership over, and they can actually move the dial if they make some lifestyle changes or they add certain pharmaceutical or nutraceutical interventions.
Right.
Like what's your approach typically, and how do you kind of unpack that for people?
Yeah, this is a question. And working in cardiology, this is a question that I get asked daily. How much control do I have over my heart health?
Mm-hmm.
Each one of us has genetic makeup that's passed down to us through our family line. So good or bad, we all carry 2 copies of each gene. A person's genetics play a role in most, if not all, heart conditions. So coronary artery disease, for example, studies suggest that about 50% of one's risk factor for developing coronary artery disease is set at birth, by our genetic makeup, with the other 50% determined by lifestyle. So there's medical conditions such as high blood pressure, high cholesterol, diabetes. Those things are going to put you at risk for heart disease. Then we have the lifestyle factors that we're discussing. So if you're not following a healthy diet, smoking, those sort of things are going to lead to heart disease. And then you add the genetic component. So if mom, dad, or siblings have heart disease, that's going to put you at a much higher risk of having heart disease yourself. One thing that we do know that research has shown us, that if you have good genes but follow bad lifestyle choices, you have the same risk of having a coronary event if you have bad genes and follow good lifestyle choices.
Mm.
So it's really about what are you going to do with the information that you're given, right? And what I try to tell my patients is, it sounds easy, but eat a healthy diet, focus on physical activity, maintain a healthy weight, try to avoid smoking, limit your alcohol consumption, check your cholesterol, check your blood pressure, check your hemoglobin A1C. If you have diabetes, manage that. All of these things that if you utilize Lifeforce can really help guide you, toward a healthier heart.
That's great. I think that is something that we really also kind of, the messaging that we give people is that knowledge is huge. You need to know your genetic predisposition. You need to get those labs checked that you often don't get checked with your traditional healthcare provider. And to your point, like if you don't know and you're just following maybe a traditional lipid panel, it looks fine, you're in normal range, that still doesn't mean you're out of the woods.
Very.
And you really should do a deeper dive for sure. One thing I would love to talk to you about is your work in Cambodia. So I think, we definitely know that heart disease is huge in the US, and for all the reasons you stated, including the Western American diet playing a role and obesity.
Yeah.
So I was wondering, do you see a similar rate and prevalence of heart disease in Cambodia, or what's been your experience there?
That's a good question. So to preface, I love travel. I love culture. Any chance I have to share my medical knowledge with the world, I try to take it. So most recently, I was in Cambodia doing some work. And even though the resources there are not the same, their access to medicine in general is not the same. I would say that the risk factors for heart disease tend to be pretty universal. So, people that have stress is everywhere, right? So the stressors might be different in Cambodia versus what I'm seeing in the United States, but everyone has stress. It tends to be that everyone has poor sleep for some reason or another. We see the same thing with hormone imbalances. Essentially, we do see that the risk factors for heart disease, they go across the globe.
Yeah, interesting. And do you see it kind of balanced between men and women?
That's a good question. The only place that I would say that I see a difference in another country would be physical activity and diet, right? Because access and things like that. And when it comes to men and women, I wouldn't say I see necessarily a huge difference. It also is very dependent on what country you're in. So Cambodia is very specific because that was a very, we were in a third world country, and you see a different dynamic of patient population. But the underlying factors, they were the same. Yeah.
Cool. One thing I forgot to mention to everyone is please do drop in any questions. We will try to get to them either in real time or at the end for a little Q&A. So forgot to mention that. I think that differences between men and women is interesting. And I think too, women often think of it as more of a male condition. Oh, men are at risk for heart disease, and sometimes we underestimate the prevalence and risk for women.
Well, we do.
Yeah.
We oftentimes see the symptoms are different, right?
Mm-hmm.
So, and this isn't, let me preface with this. Sometimes I feel like patients come in and they think that the heart attack is going to be like this massive, chest pain where they're lying on the floor and they're like, I'm having a heart attack, and it's like the movies. But oftentimes for men and women, it doesn't tend to be that way. The symptoms can be quite quiet,
Mm-hmm.
and they are more quiet in women than they are in men. So to your point, yeah, sometimes women might be like, oh, I have this little feeling in my jaw, or maybe I have this feeling in my arm, and they just totally brush it aside.
Yeah.
And, it ends up being that they could be having a heart attack.
Yeah. Yeah, no, that's such a good call out because you're right. And I think too, many people just poo poo it like, oh, it's something, I'm stressed, or yeah, it was just a little heartburn or whatever. They can always make some, logic size it in a way. And yeah, and definitely, yeah, it's important to really stay in tune with your body. And if you're experiencing something different, to have just err on the side of caution and have it checked out.
Yeah, agreed. We think that there's going to be this big red flag that's like, okay, now it's time to kick into gear. I need to start taking my life seriously. But it tends to not be the case. It tends to be that the red flag is like a massive heart attack. And at that point, you're already there, right?
Yeah.
So
Yeah.
we really need to focus on preventative measures, what we can do so we don't get to that point.
Yeah, exactly. Exactly. I do also want to just, since we're talking about men and women and gender differences, is to flag that women, as long as they're premenopausal, they can have great cardiac protection because of estradiol, having good levels of estradiol. But when they start to enter perimenopause and menopause, and perimenopause is 8 to 10 years before actual menopause, that the estradiol levels do start to decline and women lose that protection. And research has shown that atherosclerosis and plaque formation, once women lose the estradiol, that plaque formation happens much more rapidly than you see in men at the same age.
Mm.
So even more important for women around, once they start to feel their periods are changing, or maybe they're entering their late 30s, early 40s, this is the time to be proactive and meet with your provider or a specialist who can really give you robust cardiac preventative strategies, and maybe even hormone therapy that you can start now and mitigate that risk.
That's great. I do have a question for you.
Yeah.
What are some of the key biomarkers to know when it comes to assessing your risk for cardiovascular disease? So which biomarkers do you often see that are most elevated for Lifeforce members when they start? And then how does that seem to change over the course with you guys working with them?
Yeah, great question. So at Lifeforce, because of the fact that heart disease is such an important condition to diagnose early, the earlier you detect it, the earlier you can intervene, the better your chances of mitigating that risk. So we really do believe in early detection. We check, and a large fraction of our panel goes towards cardiovascular biomarkers. One of them that I think really people need to do is the lipoprotein little a, or lipo little a. It's a lipoprotein that's almost like the glue that takes the LDL and smacks it to the arterial walls. And if you, like you alluded to before, if you've got a high lipo little a, which is genetically predetermined, then you have to keep your LDL even lower, because you've got a lot of glue and a lot of LDL, then you're set up for disaster. But if you have a lot of glue that you cannot do anything about, it's genetic, but you can keep your LDL low with lifestyle interventions and healthy habits, then your risk could be average.
Yeah. And I love that you guys are doing that at Lifeforce, because the research is there now. We know that that is super important. Not seeing it in the clinic setting as much yet. I think it is to come, but it's great that you guys are on the forefront of that, because it's so important when it comes to the heart health. And just like you said, you could do a normal lipid panel and say, it comes back good, and you're like, okay, I'm done, then you do your lipoprotein A and it's elevated, and it's important. You need to revisit your whole cholesterol panel.
That's right. Yep. The other ones we check at Lifeforce are ApoB, which is another lipoprotein, which has its own independent risk factor for heart disease. It's really emerging to be one of the best biomarkers and best predictive biomarkers for heart disease. And then we also check high sensitivity CRP, which is a marker of inflammation. The more inflammation you have, also the more plaque you can form.
Really?
And homocysteine, another pretty underrated cardiovascular risk factor that we also check. So a really robust panel to
Oh,
give
great.
people a good picture of their cardiovascular health and
Yeah.
risk. Yeah.
That's the thing, our bodies can tell us so much, but we have to check in with our body,
Yeah.
and we do, put in the work and get these labs drawn, check your blood pressure, know what everything is, and then you can make the right move for your heart health so that, again, you're not running into a heart attack down the line. And we're seeing heart disease in younger and younger and younger populations. So the time is now, however old you are, today is the day that
Yeah.
you are taking your heart health seriously.
Yeah. No, good. Is that, yeah, what is kind of leading into that? What is your approach when people say, well, when should I really start to care about this? When should I start checking? What's your approach for
Yeah,
people?
I mean, if someone comes in my office, I don't care if they're 20 or 40 or 80 or 90 or 100, like today is the day. So we should think about our heart health as early as possible. I think that's why it's still such a huge issue. I think it's not uncommon for people to think that they can live, whatever lifestyle that they want to live. And that there's going to be some sort of sign that things are getting bad. People come in my office and they say, I feel great. I feel really good. And I look at their cholesterol and I look at their blood pressure and I look at their hemoglobin A1C. And I said, you might feel good, but all of these things are going to catch up with you. And then, to the contrary, I see the patient that's had the heart attack as early as late 30s, 40s. And, they're like, how did this happen? And I'm, here were the signs. So there's not an age to put on it. In my opinion, is as young as you feel comfortable to do so. It's the lifestyle prevention. It's the exercise. It's the following a healthy diet, which I think we're going to get into.
Yeah.
And then just making sure that all of these labs and biomarkers that we're discussing, that you're actually getting them checked and taking that part seriously.
Yeah, exactly. It's never too young. That's the bottom line, right? Yes. Um, so what are some risk factors that you would want, kind of the sneaky, underrated ones
Yeah.
that you like to kind of flag for people?
So personally, I think that the three most surprising lifestyle factors that people tend to not think about is something that might affect their heart health, include chronic stress, poor sleep, and as you were discussing, the hormonal imbalances. I think we oftentimes don't think about these things because they're quite frankly hard to manage. We tend to think about stress coming from an emotional perspective, and we don't think about how stress can actually be impacting our body on a physical level. But we do know that stress can cause inflammation in your body, which in turn is linked to factors that can harm your heart, such as high blood pressure. It can lower your good cholesterol, so your HDL. We also know that chronic stress can affect your heart in more indirect ways. So when you're worried, you tend to sleep more poorly. You're also less likely to exercise, make healthy food choices, watch your weight. So all of these lifestyle factors we tend to sometimes brush aside, but we know that they can cause problems down the line.
Yeah. And that's why it has to be such a holistic approach because, yeah, it's not just a numbers game and, improving biomarkers, but it's all of
So
these too that can really, yeah, impact your risk. Yeah, Lifeforce, we're exactly the same way. We are very mindful of people's stress levels, their ability to cope with stress, how do they manage stress and anxiety, and then similarly with sleep. I think we all have gotten very into some bad habits with being on our devices late at night or having it on our nightstand in the middle of the night. We're looking at it or checking things. And yeah, I think as a society as a whole, we have some work to do to reprioritize good quality and quantity of sleep.
we do. And the focus needs to be there because it's hard. Most people are experiencing, high anxiety in their life, high stress. We think poor sleep. We got moms with kids and dads and, all these things. And so we just think that it's the normal thing, but it's not, and then you fast forward and you see what that did to your body over time. So that's definitely where the focus needs to be.
Yeah, exactly. I know, and that's one area where I think a lot of people, it's hard to do on your own, and it's sometimes important. At Lifeforce, we've got a team of amazing health coaches that they love to do these deep dives with people and find out where the gaps are and how can we give people strategies to, if they're a busy mom, and like, yeah, how do you eat right? How do you manage your stress? How do you prioritize your sleep? And yeah, the coaches, I think, do a great job in doing kind of those deep dives and looking at and giving people the
Yeah.
tools to to manage them.
Tools. You need to know what the tools are. And so having somebody to help guide you through that is invaluable.
Yeah, yeah. Okay, so let's see. Before we wrap up, would love to know kind of your go-tos for like what are the few lifestyle recommendations that you love to do and love to advise people on.
Yeah. So my three, which I don't think are going to be a big shocker to anyone, but can be hard to do. First and foremost is going to be physical activity.
Okay.
So we know that we're supposed to get 150 minutes of exercise per week, which essentially is 30 minutes, 5 days a week of even just walking. I think we so often talk about exercise and we think we have to go to the gym, we have to be in there for hours and hours, and people are just instantly like, that's not me. I've never done that in my life. I don't want to do that. It doesn't have to be that dramatic. So I tell my patients, if you even open your front door and walk 15 minutes one direction and 15 minutes back,
Yeah.
You're winning.
Yeah.
So get out and get your body moving for 30 minutes. The recommendations 5 days, I'll take 3, I'll take any, move your body. And then if you can add days where you're doing some sort of muscle training, that's great as well. Secondly, obvious diet, eat well, focus on proteins, vegetables, fruits, try to eliminate, the processed foods and the sugars and the flours. I tell my patients if it's white, try to avoid it. The pastas, the white rice, the breads, that sort of thing. And then third, as we've discussed, and I'm just going to keep reiterating it, make sure that you're checking your labs, check your hemoglobin A1C, check your blood pressure, know your cholesterol, know what your hormones are doing, make that appointment and utilize Lifeforce. I mean, here it is, like they'll guide you. Those are the three things. So focus on physical activity, focus on the food that you're putting into your body, and then be aware of what's going on in your body by doing your labs and checking in that way.
Yeah, love it. All amazing tips. And for anyone who is interested in joining Lifeforce, we are just about to end a heart health promotion, which gives you 45% off your diagnostic. So you can go to mylifeforce.com/live to kind of take benefit of that. But yeah, we definitely want to empower people. With the more knowledge you have, the better you are at winning this game. So are you ready to take some questions?
Yeah.
All right. We've got one from Jerry01. How bad is high cholesterol for heart health and risk? I have heard if your arteries are clear, it is not too risky.
Yeah, it's a good question. So the only way, let me back up a little. The only way to really know if your arteries are clear would be to do what we call an angiogram, where we actually go in and visualize the arteries. Okay. But we don't just do that routinely. We're not going to do, an operation or procedure, if you will, unless there's a reason to do so. So we use the biomarkers as a way to kind of guide what we think your risk of coronary artery disease is. And the big way of looking at that is looking at a cholesterol panel. And then now, as you're discussing, there's more biomarkers that research is starting to show can tell us even more information. So once you kind of have that knowledge, again, you do with it what you will, but we do see that when you have elevated a lipid panel or a lipoprotein A, these are precursors for your chance of having a heart event in the future.
Yeah. Exactly. I think, yeah, you're absolutely right. And I completely agree. It's not enough just to look at a basic lipid panel, especially because you can't always know that your arteries are really clear. So it's important, especially if you have a family history or you think there might be a genetic link, it's important to do a deeper dive for sure.
Definitely see a strong correlation with a family history of coronary artery disease or heart disease, specifically, again, when we see it from mom, dad, and siblings, so the immediate family. So if you know that your mom or dad has had, heart disease, know what the diagnosis was, know at what age they were diagnosed, and just have that information, because there oftentimes is a relationship there.
Yeah. Another question from Oswald. Shouldn't we be looking at the big picture of all biomarkers and all risk factors outside of these biomarkers? Yes, yes, yes. Yes, and that's so important, is to look at the holistic picture.
Mm-hmm.
How are people's stress levels, their overall life, how busy are they? It's easy to tell people to eat right, but let's really dig in. What's the reality of that? How easy is it really? Is it actionable? Can people change their diet? For some people, it might be a big overhaul. For others, it might just be a few swaps here and there from white to brown, or adding a little bit of dark leafy greens, with your dinner. But for others, they are on the road a lot. They travel a lot. How do they, strategize, and how can we give them those tools?
I think that's why, too, with Lifeforce, having a coach, having somebody to help guide you, because same in my clinic, every patient is completely unique. So that's a great question. And you have to address everybody individually. So their stressors are going to be different. Maybe they're like, oh, I don't have any stress. It's more about this, that, or the other thing. And so you do have to very much individualize each person. So having a coach, to kind of, it's like therapy. Like, you got to really dive in and figure out, what is it for each person, and then address it that way.
From Michael Bentley, is there a reference for healthy ApoB levels? So yeah, we really target people to be below 90 if possible. The lower the better. This is a little bit lower than what you might see in different lab reference ranges, but that's what data shows, is that if you can get it below 90, then that puts you in an optimal category. Is that kind of how you run?
Yep.
And LDL too, just kind of so correlated, is yes, the lower the better. If you also have diabetes or high lipo A, then maybe we'll be more aggressive with your LDL lowering, versus if you have, excellent other health factors and family history, then our LDL targets might be a little bit different.
Yeah. Agree with that 100%. I feel like the targets for the LDL are getting lower and lower as we're seeing that, it's okay to have a low LDL level. So
cool. Awesome. Well, thank you so much, Savannah. This was great. And I'm sure everyone got a lot of good advice and tips from you. So definitely appreciate you being here.
Thank you so much for having me. This was wonderful.
Take care. Have a good rest of your week, everybody. Thanks for joining.
Guys.
Bye.